In that letter seen by SABC News, Dr. Ashwin Vasan points to the painful and racist history within which terminology like monkeypox is rooted for communities of colour in particular. Writing to Dr. Tedros Adhanom Ghebreyesus, he calls monkeypox a misnomer, as the virus does not originate in monkeys and was only classified as such due to an infection seen in research primates. He further argues that language used in public health matters and that it has tangible effects on the safety of communities most at risk of poor health outcomes. The WHO confirming earlier Wednesday that a process of renaming the virus was now underway.
Proposals are being made, such as naming clades 1 and 2, for example, instead of using geographic-based names. For the virus itself, the International Committee on the Taxonomy of Viruses has already embarked on conversations with their orthopox virus group on whether there will be any modifications to the not only the name of the monkeypox virus, but of course there are many other pox viruses that carry similar names that have been known for a long time. So that is up to the ICTV to provide a response to that. And for WHO, our responsibility is the naming of the disease, which has existed already in the International Classification of Diseases for some time. So there is a process that we have initiated and welcome all proposals as to what the new name might be.
Dr. Vasan's letter says we are at a critical crossroads of the monkeypox outbreak and that the WHO must act in this moment before it was too late.
The naming of diseases, there was a revised procedure that WHO adopted several years ago, essentially to overcome the previous, history of naming diseases by named by place of origin or where it was first detected, or sometimes, even a name of an individual, etc. So there are standard rules now on the naming of diseases, and there's a call that's been put out actually for suggestions, and then a committee will then consider those suggestions. So we, as far as I know, have not received any proposals for a name to replace monkeypox. So that process is still open.
Meanwhile, the Centers for Disease Control has confirmed over 3,500 cases in the United States, with New York State, much like the early COVID-19 surge in 2020, leading case numbers with over 900, followed by California and Florida, just as the World Health Organization declared the virus a public health emergency of international concern.
I think WHO's statements were really strong on that when they announced that, and the urgency of doing all that we can to try and contain this and prevent it from becoming an endemic in various places around the world. So it's important to stay with that goal and to enlist whatever help we can from donors and from countries who are ordering doses of vaccines and therapies and working most closely with the developers of these products and on the issues of surveillance.
Vaccines for monkeypox remain in very limited supply, with current priority given to gay, bisexual or other men who have sex with men and or transgender, gender non-conforming or gender non-binary individuals. We also learned this week that the White House is expected to name a monkeypox coordinator to oversee the national response, as efforts are underway to prevent the virus from becoming entrenched in the country, much like the COVID-19 pandemic that remains a clear and present concern. Shervin Bryce-Pease, SABC News, New York.